What if routine visits to your doctor for monitoring things like blood pressure or blood sugar could be done in your home? I'm not talking about the old-fashioned house call. This is a brand new idea from the Center for Connected Health.
This machine has helped me understand the blood pressure routine.
And then they'll hear a bell sound. So the patient knows that I have it, they know I'm looking at it, they know their primary care physician is also looking at it.
I'm Sandy Rice, I'm 61 years old, and I monitor my blood pressure. In the very beginning when I started, it was nothing for me to have a blood pressure of almost 200. Every time I went to the doctors, my blood pressure was through the roof. And I was going like every 4 to 6 weeks to have my blood pressure checked. So by doing this, I just don't go to the doctor's office quite often.
The idea that we could potentially change how healthcare is delivered, transform the way it's delivered by allowing the doctor and the patient to interact, but not in the same place at the same time. You're going to have a set of devices, a blood pressure cuff, a weight scale, so that when you take your vital signs, they wind up in our database without you having to do any extra work.
I find it's really neat that I can be here at home and take it within a few minutes. My doctor's office can see it, not only from that day, but they have a history of it. If I ever need it, I can get it through Dr. Joseph's office.
It holds the patients accountable because when they're home and they're taking their blood pressure, they'll hear a voice recording say their blood pressure out loud.
Your reading is 161/85.
And so they feel held accountable for that number.
I like the accountability on myself because it shows me, like if I have a high blood pressure that morning, I know, well, it's because I screwed up and had the wrong stuff for supper last night or used that salt shaker.
Maybe there's a part of what we do as healthcare providers that patients aren't that excited about, but they put up with it because they don't know any other way to get it. That includes the long driving, the waiting in the waiting room, maybe we could supplant all that by a more exciting, more engaging experience using technology.
It was never difficult to start because it's so easy to do. You know, it is so easy to do. I'd rather sit here for a few minutes than drive all the way up to Highland Ave to have the doctors take it.
Sandy's been a great patient to work with for the Blood Pressure Connect program, and she's made a lot of positive changes with her lifestyle, exercising every day. So it's been an exciting thing to watch people improve their health.
Connected Health really works well when we can find those ways that it can fill a gap and improve the quality of care, improve the patient experience, and make care more efficient or lower cost.
Still in its prototype phase.
Dr. Kvidar is also developing an interactive internet wellness program called Wellocracy.
There's this vast array of people who maybe have some interest in staying healthy but don't quite know where to start. They're overwhelmed by the number of gadgets on the market. They couldn't imagine downloading an app because they wouldn't know where to start. And our goal with Wellocracy is to really reach that population. You have to change the conversation from one about sickness to one about longevity or playing with your grandchildren or making the trip to Ireland with the family. All of these things that are about things you want to achieve, that health is a reason to achieve them. At the end of the day, patients might feel more cared for.
I think back to my mom. My mom's been gone many years now, but she had problems with high blood pressure, and I think, wow, it's too bad they didn't have something like this for her back then. You know, so I think we're very, very fortunate to grow up in this age where you have the medical ability to do that.